Hey, everybody. Hi. Welcome back. So let's talk about it with Santita Jackson and friends. Of course, you caught me. Well, I've got a lozenge. I'm trying to stay hydrated, but it's good to be with you on a special edition of Let's Talk About It with Santita Jackson and friends. We're talking about the CDC masks.
Mm.
To mask or not to mask? That is the question. Unmasking the masks. Is this science or is this incentive? I mean, we have a lot of questions because we've gotten a lot of messages from the most high profile messengers. I'll put it that way. And so, everyone, I need you to like and share, like and share, like and share. We want to get your comments. We want you to be a part of this conversation too. Like and share, like and share. And please like and subscribe on my YouTube page, the Santita Jackson and Friends page. And just so that you know, we will be talking about something like this on Keep Hope Alive with Reverend Jesse Jackson on Sunday. We're going to be talking about what's happening in India,
Mm.
and India, of course, you CK Hoffler will be with us
Mhm.
because we're also talking about how the recipes for these shots are not being shared with poor countries.
Yes.
So the Western countries um, derive so much of their wealth from these so-called developing countries, won't share what many people feel could be um, a life-saving treatment with the world from which they derive their wealth. There's another study that came up this week, just to digress for a hot second, that $152 trillion of wealth has been taken over the past few years from the developing world to the Western world. There's a lot going on. So let me say hello to Jarvis and Daryl and Deborah and everybody. You all like and share, like and share, like and share. We're going to be talking about the masks. Are you also masking up? I want to know. Dawn, let me know. Good evening. Hey, sweetie. Let us know what you're thinking about all of this because this morning we got a little hot about this. So hot that I said, you know what, we need to talk about this tonight. Attorney C.K. Hoffler, president of the National Bar Association, chair of Rainbow Push. She's also a top corporate lawyer and she has a firm and she employs a lot of people. So she sees this not just as an attorney, she sees this as an employer. And I think it's important to get you in.
Mm.
Pastor Tricia Williams of the First Baptist Church of Bridgehampton, New York, which is very interesting because it's a beach community, particularly now. She's the pastor of a church. They have been worshiping, but not in person. So now, what does she tell everybody? And we're going to have other people who are going to be joining us throughout the evening. We're going to be on here for less than an hour. So we want to get your thoughts. And we've got Dr. Marnie Reeves, Dr. Shireen Reeves, who is going to be joining us shortly. In fact, she actually brought us up here. So everybody like and share, like and share, like and share, because we really do want to hear what your thoughts are. Um, Candace Simmons, Reverend Candace Simmons, one of my, I mean, brilliant. She is a brilliant comparative uh, theology. That has been her concentration, and I've been very interested in all of you all meeting her. One of my little genius friends, we worked together on the Hill years ago.
Oh, so many years ago.
Oh, so many years ago, and I don't know how many professions she has had. She's had a million of them, just like I have. But now she's a minister, and we are so grateful for her service. But she's also she was the head of her father's architectural firm. It was the largest black-owned architectural firm in the Northeast, one of the biggest in the country, and she ran it for quite a long period of time. Brilliant, brilliant. And it's great. It's great. I'm grateful to have all of you here today as we talk about the masks. And so now the mandate, well, I don't know if it's a mandate, CK. Let me be very careful with my language. I think Dr. Walensky, who's head of the Centers for Disease Control and Prevention, President Biden,
Hmm.
Dr. Fauci, three of our most trusted voices in this particular space, have now said that people who've been fully vaccinated can unmask in most instances. And it was quite stunning, but we've been hearing a lot over the past few weeks. And interestingly enough, now it happened on the same day that 8 members of the New York Yankees staff, having been fully vaccinated, came up COVID positive. And Bill Maher, one of the most prominent voices in media, he's come up positive. Many of those persons are asymptomatic, but the point is, we do know from what we have been told thus far, at least up until yesterday, that these shots neither protect you from getting coronavirus or developing COVID-19, and they don't stop transmission. The story is continuing to change. So we want to know, just everybody, what are you thinking? How do you proceed, particularly as we're about to go into the summer season, where we will be outside or indoors with a lot of people? This is a time when we really, really want to get together because we're all tired of being indoors. We are tired of wearing masks. And we're also tired of not having the information. So let me go around to this brilliant gathering of people, and more of you are coming in. We've got Dr. Shanina Knighton who's coming in a hot second, but let me start with you, Dr. Knighton. Brilliant, PhD, and a scholar at Case Western Reserve University. She is a nurse. She's one of the top infection prevention specialists in the world. Dr. Reeves teaches in the CUNY system, the City University of New York. She's about to accept another position at another university, but she's also teaching in the public high schools of New York. Very interesting profession. And she's an educator. So, and she's also a union rep. And so you all are coming from a lot of different spaces, but let me, you know what, if you don't mind, CK, let me start with Dr. Knighton.
Absolutely.
Since you're in the medical space. Talk to me. Talk to us. To mask or not to mask? That is the question. What are we doing?
So it is a complicated question because we already know that we're in a conundrum right now in between policies that are happening, best practices. We're also talking about a situation where the public prior to COVID never had to really practice infection prevention. So the onus has always been on healthcare institutions to make sure that they were keeping the patients safe. It was all about healthcare workers making sure that they clean their hands to protect patients. It's never been a responsibility of patients. So when we're talking about to mask and not to mask, it's a conundrum of the good as well as the harms. So one of the things that we often hear about in the science is how masks are helping. But conversations that are ignored, unfortunately, is the mismanagement of masks. So what happens in terms of germs when we're talking about fungus, when we're talking about viruses, when we're talking about bacteria, because of people being mouth breathers and not washing their mask within 24 hours. Mm-hmm. And we all know, especially let's say growing up in a home with an old basement, clothes can't stay wet for longer than 24 hours because they start breathing bad things. And so if you can imagine individuals breathing that in and what's happening in terms of visits that are not quite being diagnosed because of the mask. So that's part of the conundrum and this challenging decision that's being made. The other piece of it is that many are not talking about, and unfortunately, I do blame this on the mismanagement of media, is that when the vaccines were being rolled out, and I'm even going to back up a little bit and just talk about the fact that hand washing was the first thing on the radar when COVID hit. So it's like, oh my gosh, everybody wash their hands, everybody wash their hands. Then instead of saying, hey, add hand washing now to the physical distancing, add it now to the mask wearing, add it to the test, everything started to replace each other in terms of messaging. So it went from us cleaning our hands, then it went to physical distancing, then it went to tests. Tests then said, okay, now we're doing tests. Everyone needs to mask up. Now everyone's masking up, the vaccines come along and it's, oh, everybody go and get vaccinated. But what people, and I'm speaking of the public, don't have a general understanding of is how vaccines work. We're so used to this medicine or a medicinal world or environment where if I have high blood pressure, take this pill, it's going to fix it. If I have diabetes, take this pill and it's going to fix it, or take this insulin, it's going to fix it. So when these vaccines came around, it's, oh, well, this vaccine is going to stop us from having COVID. It's going to stop us from being able to get COVID. That completely replaced the messages of long-term effects dealing with COVID. So we're talking about the fact that we know that it wreaks havoc on our liver, our lungs, our heart. We know that it's causing blood clots. I know a lot of African American women that had COVID and then it ended up resulting in hair loss. So there's so many of these little nuances that many individuals are not even talking about, including athletes. So we're talking about athletes and young adults that were blacking out because they would stand up too fast or sit because they were having residual effects as a result of COVID. So when the vaccine comes and everyone's saying, oh, well, the vaccine is going to prevent you from getting COVID, it was mismanaged in terms of what the vaccine was really intended to do originally. And that was to stop the burden of hospitals. It was never meant to say that it is going to prevent COVID. So now with the situation of, hey,
hold on one second, Dr. Knighton. Did they mean to say it? Did they mean to say what they did say, which was it would, or did they mean to imply, were we to infer that this prevented COVID, but what it actually did was something else?
So with vaccines, let's even talk about flu. There's a thing when people say someone is sick and they talk about symptoms, and so let's say someone being infected and someone being ill, they can be two different things. Meaning, for example, if I get COVID, when they were having a conversation of symptomatic versus asymptomatic, of the 50%, so there's 30 to 50% of cases that would end up being hospitalized. Of those 30 to 50% that were ended up hospitalized, that was taking up resources. So we're talking about a population of 330 something million people. We have less than 1 million hospital beds. We're already short-staffed on healthcare staff. So the thought process is that if we can create this vaccine to reduce the symptomatic COVID cases, then that way it will reduce the burden on our healthcare system, which we know is suffering. It also means that it will reduce my chance and your chance of, let's say, if we got COVID and not knowing who is going to suffer most, because as we know in the African American community, a lot of people don't go to the doctor. You find out you got diabetes after it's done already, took a toll on your body. You find out you didn't already had high blood pressure by the time you done passed out, or it's done had some sort of effect on another system. And so there's individuals that didn't know whether or not they would have had these effects, like these side effects or death as a resulting of it. So the vaccine was to reduce that burden on people. And so what the messaging or how it's getting mixed up is yes, it does reduce your viral load that you'll have, which would stop you from transmitting it, but it doesn't necessarily mean that it's completely eliminated. So with the mask wearing, when they're saying, oh, everyone can completely unmask right now, the other thing is it reduces the chances of the variants or the variants, meaning like the strains that are constantly mutating. So if I go get vaccinated, if Tisha gets vaccinated, if Dr. Reeves get vaccinated, if Candace, if we all get vaccinated, then the chances of those strains being able to mutate, the variation of it is not that great like it would have been before if everyone's just walking around doing what they're doing, eating what they're eating, and their body is not passively building up the antibodies. And so it's kind of like a catch-22, right? Because it's unmasked because we can all be exposed to the same variants because we've all been vaccinated. But then what happens to those individuals that aren't vaccinated that are then mingling with those that are vaccinated? And then the other piece of it is because we are experiencing science on the live stage, we do not know how long the immunity is going to last of the vaccine. And so while many people are saying, oh, well, wow, this is going to be a tough summer, I'm predicting it's going to be a tough fall because that's when we'll be back dwelling indoors. Common colds come back around. The weather's going to be changing. There are these environmental things that are going to come back again, but yet and still being able to determine who's vaccinated versus who's not, mask wearers versus who isn't wearing masks. Also, too, I hate to say it, but we're already seeing a decline in hand hygiene practice, and that's something that we learned as kids. So when we're looking at all of these things go away, and we're saying mask or to not mask, my thing is prevention is better than treatment. So if you are in a situation of where you are unsure of individual status, A mask can't help when adding an extra layer of protection, in my opinion, understanding that we are in a current pandemic and we are not in a clear.
Wow, that's a lot of information. But we don't really hear that in mainstream media. I mean, and now mind you, let me remind everyone here that Dr. Shanina Knighton she's a registered nurse. She has a PhD. She's also one of the top infection and one of the few infection prevention specialists in the world. I didn't even know such a profession actually existed, but what she does is teach us how to prevent infection. I would encourage you, Candace, in your space in the church, you, Pastor Tisha Dixon Williams, to bring her to your church, you, Attorney C.K. Hoffler, because you are with more than 65,000 lawyers. We need to get her before these groups so that she can talk to us about how we can, Dr. Marnie Reeves, get her before your union in New York City, because we need to hear from her. She needs to tell us how we can prevent infection. So having said all of that, when you heard this yesterday, let me just do a quick round robin with everyone. C.K. Hoffler, how did you react? Okay, you're on mute. It's okay. Most brilliant things are said on mute, but it's all good. Yes. Unmute everybody so we can just jump in.
My reaction was, I'm not changing my behavior at all. Not at home, not at the office, and not in any place. For this reason. Firstly, I don't understand how Monday morning at 11 o'clock, we have to wear masks, we have to continue the regimen. And then Monday morning at 11:01, we can just get rid of the mask. See, that doesn't make sense to me. It doesn't make common sense. It doesn't make regular sense. It doesn't make good sense. It doesn't make any sense. So I recognize that part of this journey with this infectious disease and being in a pandemic, everybody and every family has to make individual decisions and determinations as to how they're going to try to live. That's what it is for me. It's just try to live. How am I going to survive? How are my children going to survive? How is my family circle going to survive this pandemic? Because there's so many conflicting stories that have been given to us from the inception, from the get-go, as the young folks say, about COVID, that on some level, I'm going to go for what I believe I know. I trust Dr. Deborah Verholden. I trust the National Medical Association. I trust what I'm hearing here from Dr. Knighton, and I don't trust necessarily a lot of the other stuff because there's just too much conflict. And I also trust my common sense and the fact that I recognize that science is not, that medicine is not an exact science, and we don't know what we don't know. So from my standpoint, even though I can analyze and represent clients and give them legal advice, for instance, in a workplace, what an employer can and can't do, should and shouldn't do, best practices to minimize liability. And I do give advice to businesses that way. And what I'm telling them is, do not have a business practice at this time where you tell your employees to not wear a mask for this reason. First of all, there could be HIPAA considerations if you try, even though there is some flexibility and you can insist that your employees, in some instances, take the vaccination. You can do all of those things, but people will misrepresent their status because it's so easy to do. I got a little raggedy card. I don't know, maybe in Chicago it's different. My card's a little raggedy card that is handwritten. People filled out some handwritten stuff on when I took it, when I didn't. My son, the second time, as a teenager will do, he's 18, forgot his card. So they just gave him another card, just filled out the first information. So what he could do literally, I mean, he did do 2 vaccinations. I was with him, but he could literally take his other card and do like a lot of people are doing, sell it on eBay, because part of it is to fill it out himself or white it out, scratch it out, make a copy, do all the stuff that people are doing now when they simply don't want to take the second shot or don't want to get vaccinated at all, because there's a lot of distrust. So we can't say that we can rely on this card, handmade card, filled out by somebody you can, manipulate and all that. That's not reliable for me in terms of evidence that someone has taking the vaccination. But more importantly, there are HIPAA issues. I can't just walk up to someone and say, hey, you vaccinated? I can, but there's a HIPAA concern right there. So that's number two. Number three, with people, I'm in the Atlanta metropolitan area. There's still people who haven't ever been tested, number one, who never were wearing masks, number two, and number three, some of them are in our community. So when you live in an area where there's not people aren't globally embracing the notion of COVID, or there's some conspiracy theorists that are out there. I'm not one of them, but they do exist. You have to really take the decision into your own hands. Look at the information you have, look at the reliable sources that you've relied on, and make decisions. And for me, as a mother of two teenage boys, one who's about to go to college, we made a determination that both of our boys would be vaccinated at 16 and 18. And I knew that my older son was not going to go away to college without being vaccinated. And we have said to him over and over and over again, this is not a guarantee of anything. This more than likely, because I can't say with certainty, more than likely will minimize the likelihood that you will get COVID, because I preach to my children, you all may survive it, but I may not. And I say that because we just buried a good friend of mine who is my same age. I lie about my age, but my real age. And she was a lawyer like I'm a lawyer. Her son, her only child, was the same age as my oldest son. And graduation, he graduated this past weekend, the day before Mother's Day, and his mother died 3 weeks ago. You see, that's the reality of COVID, and she barely went out. That's the reality of COVID for me. And that hit home for me. I knew a lot of people who contracted COVID, a lot of people were infected, some people that died, but 3 or 4 people removed. But now someone right in my immediate circle, who's like me, the same age, same profession, same age son, died 6 weeks on ventilation. See, that doesn't set well with me. And so that was like 8 weeks ago when she contracted COVID. How all of a sudden, when most people haven't been vaccinated, it's hard for me to accept that I should not wear a mask. So as a lawyer, I'm telling people to be cautious. That's what I'm advising my clients. As a mother, I'm telling my children, look, you need to answer to mommy and you need to wear a mask, knowing that because they're teenagers, they're only going to do so much. And as a business owner, I am not changing the regimen that we have at my office. We're not mingling in the common areas. Everybody must wear masks at all times. The only time they can take it off is when they go into their own individual offices and close the door, because people can close the door, and we stagger people coming into the office. That's the best practice that I can say. So Santita, I'm sorry, I'm not getting into any of the political, economic discussions. I'm getting into what's best for my family and what I know based on what I trust.
Well, Daryl Punty has said, I'm not a PhD, but this definitely is a business and economic decision to stop masking and forcing people to go back to work prematurely and to stop giving struggling Americans aid just because businesses and politicians, mainly Republicans, are saying people just don't want to work, which is not true. People don't want to work for pennies like they were doing before the pandemic. So I see you, Pastor Williams. You are nodding your head vigorously. What's on your mind?
I agree with everyone who has spoken, and I'm so grateful for this important conversation. As I said this morning, as for me and my house, we still gonna wear masks. We have been out of the church for what is almost a year and a half now. And one of the things that I know not about being a pastor and being a shepherd, shepherds don't lead their sheep to slaughter. And this is what I feel like we would be doing. As you mentioned earlier, my church is in Bridgehampton, New York, which is more commonly known as the Hamptons. It is a summer resort town. I think it is very irresponsible to make this decision so quickly and to certainly do it at the onset of summer, when, as you said, people are anxious to gather. They're anxious to come back together. This is the Hamptons, but the Hamptons really is a small area that mostly cannot contain the capacity of people that come here. There is a huge swell. A 5-minute drive can take you 25 minutes at the height of summer. We don't, and even at the onset of the pandemic, when New York City was a hotbed, we saw the mass exodus from the city out here to the Hamptons. And when that happened, our numbers spiked ridiculously. Our hospitals again became crowded. It was a drain on our resources in local supermarkets because the people who lived here could now had to fight with people who were coming in. And so I don't want to see that again. And I just think it's highly irresponsible. I'm very concerned for my members, which is the reason we have not gathered. We have not gathered for this very reason. And I have to agree with Attorney Hoffler. The idea that we weren't even given an appetizer, you want us to digest this. It is unpalatable. It is unpalatable. I cannot digest this. And speaking from a pastoral perspective, and I've said this to people, there's no incarnation where I put my people in danger. And I will not start now. There's just nothing in me that says make this move and make it okay for everyone to sit here mask free, knowing that we could put each other at risk, as Dr. Knighton so wonderfully said, that we're putting each other at risk. In my opinion, this is a lot less about COVID and a whole lot more about community. We have a responsibility to the community. And as a pastor, it is not lost on me how much my voice matters in the community. It is not lost on me how much influence I have every week that I stand at the pulpit, whether it be in person or virtually. And I will not abuse that power. I will not abuse that power just for the sake of people not wearing masks. I think it would be very irresponsible. And the one thing that I have said since the beginning of this whole pandemic, COVID is a snitch. COVID did not create problems. It revealed the problems that we already have. And here we are again. This is about politics and it is not about people. And that's very sad.
Candace Simmons, you have been, Reverend Simmons, you work in corporate America. You work in education on the corporate side, but you've also been a business owner. And you also, everybody here is a member of a family. So we all have a lot of different considerations. We've been hearing a lot of different directives just since Easter, and sometimes different directives from authority figures in the same day. What did you think when you heard yesterday? And you're a New Yorker, you like Pastor Tisha Dixon Williams, you're Yankees, you're beloved Yankees. 8 of them, I'm not kidding, it's not funny. They have COVID. That news comes out
upstate New York.
just as we're dealing with that.
I'm from upstate New York.
Oh, okay.
Buffalo.
Boom.
I just wanted to Buffalo. All right, I'm going to go back on mute.
Yes. No, don't keep take the mute off, everybody, because I want everybody to jump in. But Reverend Simmons, Candace, what did you think about this?
Well, everything about COVID has been politicized. And I and many have a lack of trust in the information that I'm receiving. So in addition to being an ordained minister, I work in real estate development and I lead real estate development activities for a nonprofit developer that develops charter schools. And so very much involved in kind of what's going on with the air. And so for me, I rarely wear a mask outside. I have it below my neck because, the virus is being diluted when you're outside in like trillions of cubic feet of air. Very difficult to get outside. And when we had our BLM protests here, we had no uptick in the virus. But indoors is a very, 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 very different thing. And in most places, there's simply not going to be enough fresh air moving through, moving out, circulated around for me not to wear a mask inside. And so even though I have not been vaccinated and I have some concerns about that, I will continue to wear masks inside, and I would suggest that people do so. And, the things that change from day to day is, for example, in schools, children needed to be 6 feet apart, then they needed to be 3 feet apart. It just, because we weren't told from the very beginning that this was largely airborne for political reasons, because there weren't enough masks to go around, we're always trying to play catch up. And it's going to be difficult for people like me, I'm a critical thinker, but to just trust, and with my other kind of health issues, just want to take something that won't necessarily keep me from getting the virus, but just keep me from being put in the hospital, because that's essentially what this is going to do. But I think for folks who have a lot of choice, and I'm fortunate to have a lot of choice, I'm working from home. I'd say if you've got to be someplace regularly indoors, I just don't know that unless you're like in a surgical setting, that there's going to be enough fresh air moving through. And so I would suggest wearing a mask, and I would suggest eating outdoors and getting together with your loved ones outdoors, or if you're able to be in a pod. I understand the need to open up the economy, but the economy doesn't care about me. I'm a Black woman with a Black family. And the virus has disproportionately killed us, and there hasn't been enough conversation about what we might be able to do to help ourselves, what we might eat differently, what we might do to be healthier. I just feel like on a certain level, like the deck seems to always be stacked against us. And so we need to come together and use all the knowledge that we have to keep ourselves healthy, to make the best decisions for our families, for our businesses, to stay safe.
Well, but you brought up something that, Dr. Knighton talks about quite often. What about, look, we've been out of these workspaces and places for a year. Have our systems, our air systems, have they been upgraded? Candace?
No, it's so expensive. It is very expensive to have even like 50% of the air changing every couple of hours. Like that's a hospital situation. That is not the situation in most buildings. And even when they start talking about moving up to MERV 13, which is the standard for a filter, that means that your HVA system, your heating and cooling system, has to be powered enough to move that air through a denser filter. And most of these filters aren't made for that. I mean, if you're a person who's traveled regularly on a plane, you know how you can get sick on a plane very, very easily. That's not it. These things are really expensive. One of the reasons why folks are wanted back in offices is because it's killing the real estate industry in New York City, which pays tons of taxes into city government to run lots of things.
That's it.
So when I listen to the languaging, I know that it's really business oriented and not necessarily people oriented. And while there certainly are some people who need to be in the office, many businesses have been able to run well without people there, provided it's not hospitality or tourism related, restaurants, the arts. Those industries have really been decimated, and tons of businesses have closed.
Right.
For other folks, coming into the office means that you're not going to those restaurants, and you're not just all the kinds of other things. And so there's a push to get people back into office spaces in order to get the economy.
Wow. I want to take the time for everyone to like and share. Pastor Williams, but everyone like and share. Dave Dowling, I see you up in Alberta, up in Canada. Love you, love you, love you. Everybody like and share, like and share, like and share. I love the conversation tonight. And welcome here, Dwight. We've been waiting on you. Pastor Williams, what were you going to say?
I just wanted to piggyback on what Dr. Candace said, and I say this all the time: anything facing extinction will fight like hell to stay alive. And so this is not this push to get back in is not limited solely to businesses. I would dare say that the churches feel the same way. Not just businesses, but houses of worship are trying to hold on to a level of tradition that they are so fearful of losing in this season. And so the push becomes, we have to get back, we have to get everybody in the building so that we can continue, so we can get back to normal. I think that is probably the most dangerous statement that is uttered during this whole pandemic so that we can get back to normal. It's really easy to glorify good old days and forget that sometimes the good old days weren't that good.
So
And
I
so, yeah.
Oh, I'm sorry. I just
No,
want Dr.
and
Katz.
hold on, stay right there, CK, because I'm getting feedback from someone. I don't know where it's coming from, but I want to make sure that we get that together. I don't know where it's coming from. Marnie, can you look into that, find out what that is? But Dr. Knighton, you were going to say something?
Yes. So just really quick, the one thing that I do want to still be cautious of and just understanding, I keep saying that we experience in science on the live stage. And so I just want to remind everyone that yes, it is true that some of the CDC's guidelines, WHO's guidelines, our state guidelines, they vary and they are different and some of this stuff don't make sense. But just like we may critically think or use our intuition of why did this change so fast, we also have to remember that science changes very fast. I'm talking about there are thousands and thousands of publications that are coming out worldwide on a day-to-day basis of new scientific findings. And you literally have our government and other entities that are aggregating all of that information to make sure that it's telling the same narrative. And so, with the mask being lower, while I do not agree with it as a practice, because I do not believe that we know the length of immunity of this vaccine yet for us to just completely dismiss these behaviors after we've taken so long to get here, the science is showing that the viral load of individuals that are vaccinated are reduced and that it lessens their chance of being able to transmit COVID. However, I also want to caution people that just because it lowers your chance of being able to transmit COVID or being able to get COVID, it still doesn't mean that you won't get COVID. It just means that it won't show up on the outside. So all of these long-term effects that someone may be concerned about, you can still be privy to. Now, as Reverend Simmons brought up, when we're talking about inside air, this has always been a concern of mine. And Santita will tell you, I continue to talk about it because I'm like, if we're outside, even when the protests were happening, no one is getting COVID from outside air. And I tell anyone, challenge me with a study and show me where someone was outside and got COVID. So when I am talking to different churches and we've talked through ways, I'm talking about last summer, we got very creative in terms of preventing COVID because people still needed to be baptized. So I'm talking about from individual pools to make sure that, they wasn't sharing droplets. Where does the pastor stand at in order for this practice to be able to happen? We did face shields. Like I'm talking about, I literally laid out whole protocols and was still able to get people safely back into churches. When we're talking about, again, we're talking about old churches. So I'm like, okay, guess what? We're going to have to open up some windows. We're not going to be able to run any fans. This is how we're going to do it. You're going to have to register people for church to make sure that they're sitting, in packs as a family. So if this family of 6 is sitting right here, okay, we know how to space it out. So what I caution people, and I will continue to tell them, is this is not a matter of just stopping life and just saying, oh, well, we're just going to have to wait for this pandemic to end. We have to learn infection prevention. There is no way out of this. We have to learn it. It has to then become internalized. This has to be a part of our day-to-day practices. I'm talking about I had them when people were showing up, they were sanitizing coming inside of the church. It's just that simple. There's no passing of the mics. There's in the singing. So there are ways in order for things to be able to get done. We just have to be strategic about it. Maybe there are outside services that needs to happen and there needs to be rain tents set up in order for ventilation to happen. I tell people when they're gathering inside of their homes, outside air. You need the outside air. And so that is a way to be able to disperse any potential droplets that may be coming in, making sure that these practices are in place. And so I think that there is a way for us to do things safely. But I also say, as these protocols are being reined back, no, a lot of them are not making sense based off of us knowing that vaccinated and unvaccinated are mingling, knowing that we don't know people's status. But I do want to say that the CDC does know everybody's status. I work the vaccination pods, which means that literally we're vaccinating about 1,000 people a day. And after we vaccinate them, it seems like there's only that little card and there's the registration form that is filled out. I'm talking about there is an extensive process of where we literally have to register the vaccines by lot numbers, by names, by date of birth, with address into a database. So every single person in the United States has been vaccinated, the CDC does have a record of it. And what they're going to do with that, I absolutely don't know in terms of if that information will eventually be released to where individuals will have some sort of verification, maybe for employers or on the state level. I'm really not sure. But I'm just saying that they have something beyond just that little card to ensure that people are vaccinated. And it's very extensive. Like I lost a vial one time, not on purpose, but it was an empty vial. And when I tell you we had to go through and find that vial because everything has to be accounted for. So it's very extensive.
Before I get to you, Dwight McKee, Dr. Reeves, you work in education and you have been going through over the past year, how are you going to get back into the schools? You were literally going into the schools, measuring the distance, et cetera, et cetera, et cetera. Before we get to you, Dwight, Dr. Reeves, what do you see? I mean, now that we have these new directives, do you feel comfortable?
I actually don't. We actually did a reopening on March 22nd, I believe. After being closed for several months, and it was interesting because I do remote from home. My students are supposed to be home, but then several of them opted back into the building, although they were not going to be in classrooms with teachers. And the first student to test positive for COVID was one of my students. He felt like he didn't want to be home with his parents anymore and went in. And by Tuesday, we got a letter that, this student notified the school that he tested positive for COVID. This is one of the things that I think the Department of Education is not seeing. A lot of the students, and I teach seniors and I teach the college level students as well, they go out and work. They're very happy, a lot of them, to be able to do remote learning and work at the same time because they're able to make their little money and then do classes online, right? So while we're thinking that they're safely at home because it's remote learning, well, they're actually out there working. And while they're out there working, they're intermingling with people. They're on the subway, they're on the buses. And, in New York City, the buses were not set up to allow for spacing. There was a shower curtain put, in between the bus driver and the rest of the seats. And I remember I was actually writing an article about this, and the bus driver told me, come right in. And I took photographs of everything in the bus. And he looked at me, he said, I can get COVID any day of the week because first of all, there's no circulation in this bus, but look at this shower curtain that they have there. It's hanging on a hook. And, as you said, air travels around. So, of course, anyone in that bus would actually get COVID. My biggest fear is that we have some administrators who want all of their students in the school building. My school has 3,600 kids. I'm sure my principal wants every single child back in every single day, straight through from 8 to 3. And that's something we had a very heated discussion this morning because, I'm looking at the fact that we are technically not allowed to ask students for their medical records. We cannot. There is definitely that HIPAA violation, but we also can ask kids if they went to the doctor. So if a kid comes in a week out from school, and we say, well, you need to provide a doctor's note because you've been absent, we can't ask them that. If they're sick, we can't say to them, you have to go home, right? The DOE believes that if they're just testing them, it's okay, but that's not enough. I've lost, I would say, over 100 colleagues to COVID. I lost my uncle in March to COVID. I lost a friend 2 weeks ago, and he tested negative in Colorado, got on a flight, was on a layover in JFK, and by the time he got to Bangui, he tested positive for COVID and died 2 days later. So,
Wow.
we're at a point where we're looking at the fact that our kids, while I understand what Dr. Knighton is saying, or Reverend Candace is saying about the outdoors, I've seen the opposite with my students who are playing in the park, right? And while they're not saying if they were in a house hanging out together, they've been outside playing with each other and in each other's faces, and they do come back testing positive for COVID. And no one can explain, well, if they're outside in the park and they're in each other's face and the wind is blowing, like you said, it's very minute particles that are sprinkling, they do get COVID. We have those students who have just been hanging out in the park with their friends and have come back testing positive for COVID. So there's so much that we don't know. And at the end of the day, this mask mandate, the fact that they're pulling back, you really have to understand it's really not about the human being. No one cares about the individual. If they did, there would have been an official mask mandate from day one. It wouldn't have been maybe you should, maybe you shouldn't. There should have been a stop to everything from minute one. And the fact that we're getting vaccinations and there's a hesitancy as well as to whether or not it's going to work. Should we end up next year getting another vaccine? Is this vaccine going to last 2 weeks, 2 days, 2 months, 2 years? There is so much that we don't know, and we're putting so many lives at risk just to appease big business. And that's going to be to this country's detriment. And we can't be a great country if we don't listen to great science. And right now, we're not listening to great science because unless you're being paid to speak the way the government wants you to speak, they will not hear you.
Dwight McKee, your thoughts? Oh, you're muted, Dwight. Dwight, you're muted. You got to unmute. All right.
I unmuted him.
You're unmuted, Dwight. Okay. Dwight, you can
Hello?
talk. Yep, we got you.
Okay. I'm not sure because because the information is changing, that the science is changing. And I don't confuse the science and the information. I think the information has been driven by politics. Much of the information has been driven by politics and the need to address the reboot of the economy. And so it seems like the information changes every day based on political expediency. Too much information at some point becomes misinformation. And we keep hearing every day some different strategy or some different analysis of what we should do. And it seemed to change at some levels by extremes almost overnight. For me in my house, I'm gonna treat it as if that it's all at the level of urgency. Keep my mask with me and stay as far away from folk as I possibly can, not to be, socially a social misfit, but certainly to keep enough distance between me and the next person, so it becomes safer for me to interconnect and then relate to them. But I'm gonna keep my mask. And I'm not sure about the vaccination. I don't really trust that yet, because again, the information with that changes every day. So to me, the mask seems to be the most viable option, and the social relationships, I think, really need to be negotiated.
Well, I think that part of the challenge that we have, and I want to know what everyone's thinking here. We've not been able to, hey, Paula, how you doing, sweetie? And she says that you are a lucky man to be surrounded by all of these lovely women. Well, how about that?
Right, McKee.
But we've not had a platform or platforms where we can really share our thoughts. We're heavily censored right now. We're deplatformed. If you print an article that doesn't say, go get the vaccine. If we're asking questions, Daryl says vaccinated or unvaccinated, we still need to be masking up and social distancing until this virus is under control. Dr. Deborah Verholden has made the point over and over again. We were actually decreasing the numbers of infections before we had access to these shots.
Yep.
We
I
were
agree.
doing some things that were right.
I agree.
And I
Flu
think
was
this
gone.
messaging, well, yeah, I mean, talk to me, because what happened yesterday, in addition to, uh, we all know that people who have died of COVID-19 have been vitamin D deficient for the most part. Now people are telling us that vitamin D doesn't work. And maybe because they don't have a cost attached to it, profit. I mean, how are
Well,
we supposed to trust
So
this information? I mean, there's just a lot going on here.
it is, but I also too just want to bring up that I think the one thing that we continue to ignore is like this is not the first pandemic and it's not going to be the last. This
mm,
is the first one that has caused us to stop in our tracks.
mm,
Meaning, like when H1N1 happened, I was right on the front line, and H1N1 could have been a COVID-19. I mean, we had over, what is it, 50, 60 million cases in the United States. But because everyone discounted it as being a flu, it was nothing when we had, the amount of deaths that we did in the United States. So it wasn't paid attention to. Same thing with Ebola. Ebola could have very well been a pandemic here. And so I think as we continue to talk about, oh, well, when we get past this pandemic, when we make it past it, it's like what happens in preparation for the next one? Are these practices something that we're going to continue to get in place that we know are going to be our best practices as we move forward? Because when we think about even now, no one's hearing about the deadly strain of Candida auris. That's a fungus, that is indwelling, particularly among older adults, that is killing 30 to 60% of people that it touches. So no one's talking about the fungus right now. We're still not addressing the healthcare associated infections. These are bugs that literally, whether I am in the lab and we are studying them in the lab to try to figure out how to prevent them, whether they're actually in the hospital setting and we're watching them, literally, I kid you not, travel and trying to prevent how they travel by doing all of these measures. It's one thing to say mask up and socially distance, but if you're wearing the same mask every day, if you're not socially distancing all the time, even if you are not cleaning your hands correctly, only 3 to 6% of the population cleans their hands correctly. I need people to understand that it only takes that one time of you slipping up and getting a little bit comfortable. It's almost like pregnancy or it's almost like birth control. It just takes one time, literally, for you to not to for you to make a mistake, and that is your very time in which you're exposed. And I think that's the thing that we continue to miss here is that these are all risk reduction strategies. The vaccine, the physical distancing, the hand hygiene, the mask, your diet. This is something people don't want to talk about. But I tell them, I hear all the time, I'm not going to get vaccinated. I don't want that vaccine. That vaccine got A, B, C, D, Q in it. But it's like, what about the meat on your plate? Many people don't know, but the meat on your plate it's vaccinated and it's on a better diet than what you are.
mm.
And this is the truth. And I'm talking about got all kinds of diseases, leptospirosis and all of that. But by the time it makes it to you, you don't recognize that. If you're eating lunch meat, your meat in 2006, any kind of lunch meat, any kind of processed meat, was approved by the FDA for spray on viruses to go on your lunch meat or on any processed meat, an intentional virus. And you can look it up. And so when you look at that as being something that is on the food, so, oh, they're intentionally spraying viruses on my lunch meat or on my pepperoni, we have to be cognizant of what's happening and not just attribute it to, oh, we need to get past this virus. Because when the next bug shows up based off of how we eat, how we behave, how we interact with the environment, no one's talking about where all of these masks are going, which is, to our water. No one's talking about where all of this waste is going with the gloves. We're not having these conversations because they're so reactive. So we're going to be talking about this down the line when we think we've made it past COVID. Same way we won't be talking about the long-term effects of COVID. The whole fact that no one has primary care. No one has primary care providers, or not a lot of people have them. And this is literally when I'm talking about AIDS or just like even H1N1. It found out later on that it had fertility issues. Okay. All of these things show up 5, 10, 15 years later. I can go through viruses, HPV, right? Found out later on it was attached to brain cancer. for men and cervical cancer for women. But guess what? Everybody like, oh, this STD don't burn and don't hurt and had no discharge like the other one, so we ain't got to worry about it. And we find out years later that it's attached to cancer. And so I always caution people while we're talking about things now and what it is we should prevent, and in the midst of it, start thinking about your health now and think about how you need to be the CEO of your health. If you were exposed to COVID, if you weren't, you should still be tested just to figure out if you had it, because you don't know how it's gonna show up later on.
Do you
Well,
think
just
now? Yes, so please, Pastor. Yes.
I just wanted to jump in here. Dr. Knighton talked about all of the long-term effects, and someone put it in the comments also. We're also not talking about the long-term effect of our mental health and well-being as a result of all this, and the compounding trauma that we have sustained and are still sustaining in the midst of this pandemic. It's literally one thing after the other. And if I can speak to this as a clergy leader, I have a friend, Dr. Bishop Guy Robinson, who talks about the critical collaboration between mental health professionals and clergy. That we have to understand that this is a point in time where we're possibly dealing with mental issues that are beyond our capacity for counseling, and that we cannot be afraid. The same way we would call in a Dr. Knighton, the same way we would call in a Dr. Holden, we cannot be afraid to call in the experts when it comes to mental health throughout this entire crisis, because we are suffering. And a lot of our leaders who are at the forefront of this, entrepreneurs included, we are suffering with trying to figure out how we manage this. There is no playbook for this. We are the keepers of the story of 2020. The playbook is literally being written by us. And so that is a great pressure, a great weight to have to live with for the last year. And we are going to need some mental health. I always say you need a couch and Christ. You need a prescription and a prescription. They are not mutually exclusive. They work hand in hand. So I think that's something else we're going to have to think about: the mental health challenges and the collective PTSD that we're all suffering in a season like this.
Reverend Simmons, what about you?
I think we need more things like this where we're willing to engage in conversation. So much of what Dr. Knighton shared with us is exactly the opposite of what Big Pharma and Big Food want us to understand. So when I'm on Instagram and a friend says, "Ooh, that second shot was horrible," what comes up? But something on the bottom there saying, if you this and this about the vaccine, that has nothing to do with that person was just saying, I had a tough time with the second shot, right? But then all of a sudden, automatically, there's something that comes up and says, if you have questions about vaccines, go here. And we need to be able to get into conversations and not call ourselves quack when we say we have quacks when we have absolutely no need for sugar in our bodies. When we look at kind of how foods take us out, and we're already stressed as people of African descent in this nation, that people are more interested in managing sickness than promoting health and wellness. And, we tend to say that those folks who have those conversations are the nuts and berries and those kinds of things, the Dr. Sebi crew and all that kind of stuff. But these are, if we're going to continue to have these kind of issues, as Dr. Knighton is saying, then we need to have some other options, and we have to be able to discuss those without being shut down. And so we're really not having discussions about how food is medicine. We're really not having conversations about mental health. It's still, for us as Black people, something that has to get pushed aside. And I'm someone who's experienced a close suicide in the family. And if he just had an opportunity to talk to somebody, because he was hiding it from us. And so there's this need for open conversation, which seems not to be allowed in this push for whatever COVID is bringing us to, right? So that these billionaires are making more and more money, but most people are suffering. Something else is going on here. And we have to have conversations that get us to a place and keep us in a place of health to the best of our abilities, but also challenge us to question what we are being told and why it's being told to us. the
Well,
information, as Dwight mentioned.
Yep.
without being treated with suspicion and derision. I mean, I think that is really the key because I think we're in a very interesting place. It's an inflection point, but it's also a very dangerous place. As you did mention, Candace, as soon as you mention COVID-19, automatically a sticker shows up on all of your social media platforms. We're watching people, we're watching scientists get deplatformed.
Mhm.
We're watching a lot of people, even in conversation. If someone asks you if you've had the vaccine, and I have not had it yet, I'm not an anti-vaxxer. I just want them to work out some of these issues because no one's asked me what my health challenges are. I nearly died in 2004. So there's some things that I've got to watch out for going forward for the rest of my life. I can't even be an organ donor. I mean, there's just a lot of things, and with that, the things that I have to watch out for. And I would caution and urge everyone to watch. Now is the time for you to become the marshal, the steward of your own health. You've got to do that. And so you shouldn't take anything blindly. My question has always been, why don't I have a choice which vaccine I can take? I mean, no one size fits all does not work for anyone. There's so many questions, and that's why I want us to continue to have more of these conversations. Of course, I have it on my radio show 5 days a week on the Santita Jackson show, but I also want to have more of that here. You know, we've been on hiatus for a little while because my workload is just very, very heavy, and I've had to engage in, what do you say, Candace? The radical act of self-care. That having been said, I think we're all being forced into the radical act of self-care and self-knowledge. And I hope that we will get to a point as we do a round robin and get closing thoughts from everyone. I want us to talk about Medicare for all, universal single payer. If you get COVID-19, can you afford to get it treated? People last year ended up with bills that were in the tens of thousands of dollars, if not hundreds of thousands of dollars, getting treated because COVID-19 hits people, everybody very differently. For some people, it's a respiratory illness. Other people, it's neurological. But it's just all kinds of stuff. And there are the long haulers. So let me just go around everyone because we've been on for about an hour and it's been fun. But I promised you, because I want you all to come back and do something else today, I'm not going to keep you all night long. But let me start with you, Dr. Reeves, as you are going to be with these children, to be with our young people. Um, with this new information, how are you going to handle dealing with these young people who think that they are invincible, invulnerable?
Um, I'm going to say that I think COVID and everything that happened within the last year allowed them to see that they're not as invincible as they think, a lot of them. And they were certainly traumatized while they were awakened by the fact that they're certainly powerful beings. They have certainly been traumatized about everything that's been going on, not just with COVID, but with witnessing the deaths of George Floyd, hearing about Breonna Taylor and so many other people. And what they do need realistically is support from everyone. That understanding that while they're growing up and coming of age, that they also, are vulnerable. You said that to me this morning, Santita, as my, as someone who doesn't often say I'm tired. I've heard a lot of my students say, Miss Reeves, Dr. Reeves, I'm really over this. I just want to escape and I just want to get away. So my role as an educator is to ensure that I not only fight for my colleagues who have to stand before these children and ensure that they're educated, but also to support and nurture the children who come before me and the adults who come before me, and ensure that they know that they can get the help that they need, not just the reading of the literature books that are brought to them in the classroom. And that's something I think everyone needs. And the support does not only end with the students, but also with the parents, the entire family. I've requested through my principal and with the union that we extend that support support to parents and families because they do need it. Because while we have to deal with them for 6 hours and 20 minutes a day or maybe longer, we don't know what they're dealing with at home. We have a lot of homeless families that have
Mm.
gone through this entire year without no end in sight, no help in sight. And again, yes, anytime somebody says we have to start marching for universal health care, I can tell you we have at least 3,000 students and their families ready to do that because we definitely are bursting at the seams and in need of help for those types of support in this country. And, at the end of the day, COVID came along at a time when we needed to open our eyes to the needs of the people, right? And if after COVID is gone, we have not fulfilled those needs, we have done a total disservice to the people in this country.
Hmm. Pastor Williams, you said that COVID is a snitch. Whew.
It is a
And it,
snitch. It
and
does
it
not.
has exposed, we've been exposed, we've been left exposed.
We've been left exposed, and it has done the exposing. And but here's the thing: it hasn't all every. And this is another thing that I've just been saying. It ain't been all bad. It exposed some things that needed to be exposed so that better practices and policies could be put in place. And it killed some things that caused our hearts to break and grieve. But we can also be honest and say that COVID put an end to some things that needed to die. It created a very fine line, a very clear line between some of the policies and practices that we had in place that needed to die for a very long time. And even just in terms of, and I think Dr. Knighton touched on it, and we talked about it, I think Reverend Dr. Gina Stewart said COVID is the cradle of creativity. And we have been able to think beyond our normal thought patterns in this place. We have found that, as you all suggested, people have been more productive at home in their workplace. To some degree, work-life balance has been restored. Churches have been forced to do things differently. Perfect example, there's a finite number of people I can fit in this building. I reach 100 times over that many people every week now because we are forced to use the virtual platform. And so while there are things that I certainly grieve about and cry about, we buried one member because of COVID, and that was one member too many. And so there are things that have broken my heart and wounded me, but there are other areas in this pandemic in which I have rejoiced for the change that has come. Good change and necessary endings. And so while it's easy to focus on what has been difficult and horrible, I think we also have to think about some of the ways and the paths that have been made in the midst of this pandemic. And what I would caution everybody, as I said earlier, is not to be so fixated on we just got to get back to normal. No, to some degree, we've been given a gift to dismiss normal and begin to create new and exciting ways of doing, whether that be marketplace or ministry. We have been given a gift, and I don't think that we should waste it.
Wow, Mel Lockett you're resonating with him. He said COVID-19 is another instruction from Mother Nature. We are a part of the process. Attorney C.K. Hoffler, you see this from a whole lot of different angles. As we're getting these different instructions, as we're really continuing to wend our way through the process, what say you? How do we proceed forward?
Well, I say three things. One, there's a silver lining in every cloud. We're never going to go back to the way things were. This is the new normal. So that's number one. Number two, just on COVID, all I will say is that my good friend that passed away tested negative twice, 2 different COVID tests, and still got COVID and died. And then 3, I just finished an international conference where the discussion was how it was inexplicable, according to some statistics, how in countries on the continent, on the African continent, had very low numbers of COVID. And so we unpeeled that onion, and there are certain things that are inexplicable, but there are certain realities. They don't have the testing centers. So many people tested have gone, there's not the documentation. And 2, they don't have the access to the vaccinations if they wanted them, even if they wanted them. And 3, one thing that we have to realize is in countries that are perceived as developing countries, they dump all the defective stuff. So anything that these pharmaceutical companies messed up, jacked up, all the tests, everything was all messed, they're going to dump them, all of that, and on the African continent, in South America, Latin America, all of the Caribbean, all of those countries will get the leftover nobody else wants, defective and everything, just as the tobacco companies did. So the thing that we need to just, I go back to my last point, we are all experiencing some form of PTSD. Govern your own body and get help if we need it. And just realize there's not going to be any going back. But I have had more extraordinarily wonderful and just incredible conversations with my children over the past year and a half that I probably may not have had, but for the fact that they've done virtual learning, and I have worked from home a whole lot. So there's always a silver lining in every cloud.
Dwight McKee, your thoughts about this? Dwight?
Well, I think she's right. I think this is the new normal. Hello?
Oh, you're
Hello,
here.
can you hear me?
We can hear you.
Hello?
Dwight, we can hear you.
Okay. I think she's right. I think she's right. This is the new normal this week. I think there might be another normal next week. One thing we learned from this situation is life is fluid and it can change on you in a heartbeat. And that the one thing this has done for everybody, I think, is given us a chance to realign our values and our priorities and to understand that life is not promised to you, particularly in the way that you had it yesterday or day before yesterday. This bad boy change on a dime. And I think those who are most pliable and most flexible are going to be the ones that be able to survive these changes. And the ones who are really rooted more in grounded in spirituality and in faith will be able to survive. As the one thing we're learning from this, that all of this can change on a dime.
Just like life. Reverend Candace Simmons, your closing thoughts?
Like so many people have said today, this is an opportunity, and it's an opportunity for us to find new ways to focus on our physical, mental, emotional, and spiritual health, to support each other in different ways, to be open to conversation, to be open to interaction. But also with that, it's an opportunity for us to engage in critical analysis of this information that is changing rapidly from day to day, and be rooted in something that is greater than what we're hearing on the news. And to avoid operating in fear, but to focus on faith and relationship.
Amen to that. Dr. Shanina Knighton, you can close us out. We need some information. We've had a lot of inspiration, and I think you've got to fuse all of that. But having one of the things that we appreciate about hearing from everyone is that in your various spheres, if you just add it all together, you get 360 degrees, you get the whole thing. Dr. Knighton, where do we go from here? Because doubtless we'll hear something else tomorrow or next week that might change our behaviors.
So I'm going to tell you this. Stick to what it is you're doing. And I cannot preach enough in terms of being mindful. So when I'm saying being mindful, when you know that you are out interacting in the public, when you know you are interacting with others, this is the time to be conscious about the activities in which you are partaking in. I'm talking about something as simple as your cell phone. Cell phones are 10 times dirtier than a toilet seat. So when you are at the store and you have your mask on and it's up to your face like this, think about the fact that that dirty cell phone is touching your mask. Then think about the fact that you have not cleaned your hands and you're texting on your phone and you're putting it right back up to your face. You set it down on the counter so you can grab your card to be able to pay. We don't think about these things. Make sure you're cleaning your phone at least 2 times a day. With your mask, and I'm going to grab a mask really quick because I have to provide this and I always do it. But when we are talking about mask and wearing masks, I'm still seeing this. I'm still seeing people wear it up under their chin. I will tell you, I see every woman on this panel right now
My
COVID
children,
exposed.
my teenagers, every day I'm having to tell them, what
Well,
is this? What are you doing?
CK, I'm about to give you something that you getting ready to look. You gonna educate them after this, okay? So what I tell them, so this is supposed to be up here. When it's under here, all of us right now, our necks are exposed. Men or women, our necks are exposed. COVID droplets, okay, can live on the skin for up to 9 hours. Studies have been done showing that. So if we are out in public and let's say we all talking and some of those droplets travel, or let's say we got on the elevator and they are suspended in the air, guess what? You now did this when you done went outside because you needed your break, and then you pull it back up to your face. So you've taken everything that was on your neck now and you've put it right at your mouth and your nose, and COVID transfers eyes, mouth, and nose. The other piece of
Look
that
at CK's face.
the other
I'm
piece of
sorry.
that
He's done.
is
I need to take a nap.
Wait,
I need to go. I need to take a
now,
nap.
wait a minute. Everybody laugh. Hold on.
seriously.
And you know, a mask doesn't work with lipstick.
I know. The other look, I'm telling you, another piece
I
is
was looking at CK's face.
I know. Look, dad do this. How many of y'all readjust y'all mask from the front? You doing this, so you touching it from the front. I can't do it because I got the headset on. But imagine your mask being over here. How many of y'all pull it up from right here to be able to adjust it on your nose? Your hands are contaminated. You should only grab it from ear to ear to pull it back up over your nose if it slips down off of your nose. But you should never grab it from the middle part because you're contaminating it. So I always advise of that. The other piece is when we are talking about your fingernails, COVID can live on plastic for up to 4 days. Okay. If you have artificial nails, if you have long nails, if you are not scrubbing them with a toothbrush, then I'm telling you, you have failed because it harbors germs, not just viral germs. You can harbor fungus up under there, and you can harbor pathogens up under other pathogens such as bacteria. It is important that not only do you clean your hands for 20 to 25 seconds, you're scrubbing beneath your fingernails. I'm going to give one last tidbit, and that's when you are actually two. When you are out and you are eating fast food, the person that is touching your card, okay, let's say you in the fast food line and the person is handling the money is also handling the food. Those gloves, I've watched many times, and I want y'all to pay attention because I'm telling you right now, you're not going to want your drink after you see it. What they do is they take your card, they give it back to you, right? They got their gloves on, and then they go and they fix your drink. When they fix your drink, they put your ice in your cup, but they take the palm of those gloves that they've just took that card with, and they put the lid down on it. So you now have everybody's contaminants that was in that line just right on the top of your lid for your beverage. The ketchup, the mustard, the bagel cream cheese that they put right in the packet next to your bagel, that was sitting in a refrigerator that you don't know if it was cleaned or not clean. It was sitting inside of a cardboard box. And we also know that roaches love cardboard boxes. Okay.
Y'all remember Lurch from the Addams Family? He was like,
I'm being honest. But no. But let me tell y'all why. Let me tell y'all why I gotta tell y'all this. Because
telling you what we need to know.
I see that you're done.
Because you done made it home, right? You done made it home and your stomach
needed a
is
laugh
sick.
break.
I get it. But your stomach is sick, right? And you sitting up here like, dang, all I had was that burger from the place. It probably wasn't a burger that made you sick. It was what happened around you eating the burger or eating the French fries that made you sick.
Well, I have to say, Dr. Knight, one thing. I have had the experience, unfortunately, of because I carry those spray things of spraying people in the face. And I had to just apologize. I had on my mask and stuff, but they were too close. And I apologized because, first of all, what are you doing so close to me? Because if you weren't at that close to me, you wouldn't have had spray in your face. I didn't mean to spray the person in the face, but you are confirming that I need to go further because all of these things, this is a lot of stuff. I got to go to sleep. I got to pray about it. I got to get up in the morning and start again. I'm going to be Cloroxing. I Clorox my house. At my home, I might have sprayed my kids in the face. When they're asleep, I'm up there in their room. But I now know I need to continue because you reminded me that one little slip up. but I need to go to bed first, pray about it. We got some ministers on the phone. I need to pray about it, go to bed, maybe sanitize my bed first, then go to bed, go to sleep, and then get up in the morning and re-energize
Oh
and
no.
spray a few people in the face again.
Yes.
D. Ray Jones said, "This is a jaw dropper." That's why I wanted her to be the last person. Look,
And
don't stop.
I
Yeah.
promise this the last one, and this is in all seriousness, because just as we all talked about, like COVID has touched our families. Other illnesses have not stopped. So we still got loved ones that are going in for diabetes, going in for surgeries, going in to have babies and everything. I will tell y'all that for over the past decade now, I have been studying infection prevention among patients. And so my infection prevention work among patients has now translated over into the community because of COVID. One of the things, and I can tell you this is nationally, even internationally, that does not happen is patient hand hygiene.
Mm.
It is not mandated or mandatory for hospitals to educate patients about the germs that surround patients and to also make sure that patients can clean their hands inside of healthcare settings. I challenge you, if you have a loved one that was recently in the hospital, ask them, say, did you work with, did someone give you something to be able to clean your hands when you were there? I guarantee you they're going to tell you no. Did someone educate you about healthcare associated infections? I can guarantee you they're going to tell you no. However, the bed rails are contaminated.
Yes.
Your call light is contaminated. Your IV pump can be contaminated. Hospitals are dirty. We are asked to walk as a patient
Mm.
3 times a day on the hospital floors, and you put those same nasty footies
Oh
with
Lord.
unseen drainage right back in your bed.
Mm.
Okay. So if I can caution anyone that has to go inside of a facility, make sure that they have something to clean their hands adequately. Make sure that the surfaces around them are wiped down, and make sure that they are changing the footies that they walk around on the floor with, because they're going to take those germs and put them right back in their bed, and that is going to increase their risk for getting an infection. And right now I'm working on policy in the state of
Dr. Knighton, I
Ohio.
need you to come talk to my students. Mm-mm. I need you to come talk to my students. Please, please,
I will.
please. Mm.
Hey, look, I need all of y'all, because I got questions. Look, I got questions for CK.
I'm sweating and carrying on, feeling sick in the stomach.
I get it, but I'm so serious about that. Like, if you got somebody that's going into a facility, please make sure that they are taking care of themselves. Infection prevention, because it's been so archaic, and this is where science fails us. This information has been around since the 60s, okay? But a fault of science is that it can be biased in terms of how the results are reported and what's emphasized. So the same way healthcare workers had germs back in the 60s, the same way patients did. But the only policies that have been put in place has been healthcare workers. So please make sure y'all focus on yourselves and loved ones that y'all have.
Well, Carol Saskin said, "Oi, hey, I need to be in a bubble." No, Carol, it's not as bad as that. But this is this is my sister from the left coast, West of Heart. She's up with us at 4 o'clock in the morning and before every day of the week. You know what, everyone? First of all, let me thank everybody for joining us tonight. Please, can Paula continue to like and share? Candace, these people have been with us since 4 o'clock this morning. Some of them, fine, and I love all of my brothers and sisters. But you know what? I'm glad that we got a chance to get all of your perspectives. Dr. Terrain Reeves, Attorney C.K. Hoffler, Pastor Tisha Williams, Dixon Williams, Reverend Candace Simmons, Dwight McKee, and Dr. Shanina Knighton. We're so proud of all of you and so excited to see you. Unfortunately, a lot of us don't know that there are so many, I would say, Black people who are this accomplished and this concerned. And that's not excluding any of my white brothers and sisters and brown and indigenous. Well, people are marginalized. Indigenous people are marginalized. Women are marginalized, and on and on and on. But I have to say, in a special way, to you, Shanina. Shanina is the first person in her family to graduate high school. Come out of high school. It's not been easy for her. And one of the things that I love about you, Shanina, as you went on to become a registered nurse and as you became the first person in your college, in your family to come out of college, and then you went on and became a nurse, and you became a PhD, and then you became this infection prevention specialist, one of the few in the world. You're bringing this information back to the people who need it the most. We all, as just, if you're in America, you're a rejected person, white, black, red, yellow, or brown. But poverty never stopped us from being clean. But being clean and being hygienic are two different things. And what we need to do now is really understand how we can really, as they say in the popular parlance, live our best lives. But we need to go deeper. Everyone deserves a clean, hygienic place to live. While we are putting a lot in foreign aid, while we're putting a lot in war, while we're investing a lot in corporations, I think that the very least we can do while we're arguing about billions when we need trillions really to get America back on her feet, we have air systems that need to be reworked and retrofitted for the 21st century. Nobody's going to go back to all these buildings to go to work. Something needs to be redone here. And I think we have to not just reimagine, we have to rethink healthcare in this country. Because while everybody's running after me to give me a shot, no one's running after me to give me the healthcare that I need to take care of COVID if I get it, or cancer, or a heart attack, or AIDS, and all of it. This is a time for us to make those demands and really to believe that we deserve that. We really thank you, Paul. You said it's a great panel. Of course, it was almost all female. I know you love that, Paula. How about that? She said, sorry, Dwight. But, really, I really, also, we will take the time to rethink how we're living. Really, to rethink how we're living. And, we all laughed at you, Dr. Knight, but we were not laughing at you. This was nervous laughter about ourselves because we have all done something that was totally gross. So I want you to know, I was walking around with my gloves and I thought I was doing the right thing. And you said, oh, Santita, don't tell me you've done that. I said, oh, I guess so. And, because I saw people in the airport last weekend doing this with their hands. That's what they called washing it. Literally like that. And I was like, oh, no. Don't tell me while we're jammed up in this airport and on these planes together that you've forgotten or you didn't think about cleaning and washing. So you know what, everybody, let's just be mindful. And you know what, Dr. Knighton, we're going to bring you on by yourself to do a clinic on what we need to do to be clean. And maybe we'll have a couple of some other people who actually have workplaces and workspaces. Because we need to know how we can be clean in our workspaces, how we can cut down on infection, and what we need to do. How do you take care of the restaurant? I mean, there are a lot of questions I think that we need to ask, and we're not even thinking to ask. We were laughing about what you did with the masks, but it really was nervous laughter.
You should have saw the hairdressers when I was telling them about not fluffing their gowns, like when they was talking about going back like they capes and stuff and no jewelry. So I had a whole segment for them. So I've actually done this for quite a few industries now. Just in turn, like making it very specific to what it is they do, because I'm not an expert in every industry, but I can tell you how to be safe at your work.
Well, no, I mean, you live in the community. So you see things that we're doing in practical ways every day that are just unsafe, particularly because we are still in a pandemic, everybody. Just remember, we are still in the pandemic. Dr. Knighton, before we go, are we still in a pandemic or has it passed?
No, we're still in a pandemic, and we better be careful because I'm telling you, before we was on track for one every 33 years. This has been within 9 years. And so who knows if global warming or the environmental changes are contributing to this. I always say stay ready so you do not have to get ready. And that means with your immune system, that means with your infection prevention practices. Next time the news tells us something late, okay, that we are in a pandemic, you should already say, oh, this ain't nothing to me. I'm going to just keep on doing what I'm doing. Just tighten up a little bit. So that is the kind of mentality that we all need to take. I mean, as I mentioned, and it's not again to get on the food industry, but y'all remember when they had the restaurant menus and you done went and washed your hands getting ready to eat, and now you touching the salt and pepper and then touching your fries, and a lot of other people touch that salt and pepper and that ketchup. So I'm just saying, like, I can give you plenty of examples, but that is more relevant because we all eat. So I'm just saying, like, there's a lot that we really could be doing that's better that we just don't think about.
Okay. Now that everyone feels sufficiently grossed out by themselves and our personal habits, I just hope that you all have a wonderful evening. But you know what, Dr. Knighton, thank you for this because you're making us become
Yeah,
conscious.
thank you.
Thank you. You're waking us up. We've been unconscious. And you know, when you come into consciousness, you ask where you are. Not who am I, but where am I? This is where we are right now.
Yes.
This is where we are. So everybody, let's get to
I'm
it.
just looking at CK's face and laughing.
I'm
CK,
sorry.
your
Because
facial
TK's got an
expression.
office, and she is like, "Oh my gosh, I'm looking at you, Dr. Reeves, because
Yeah,
you got these kids, and I'm looking at you, Pastor Williams,
you
because you
know.
got your flock."
All
Ah,
I'm hearing in my head is I got food at home. Like that's you can have
Thank
this
you,
King
Dr.
Mile
Knighton.
outside dining experience. I'm like, I have food at home.
it's a lot.
Yep.
But
Dr.
look,
Knighton, I will not collect another sheet of paper ever. They will have to email everything from now on.
Not
It
the
will not
paper.
happen.
So I can't tell you this. The
No
chances of
paper. I want no paper. After all of this, I will not collect a sheet of paper. They will have to upload everything in a database and I'll set it up. But no paper. Mm-mm.
I'm
Nope.
telling you though, it's
I
not the
can't spray the
paper.
paper, CK.
wait a minute. You're saying it's not the
No
paper. What is
paper.
it?
It's not the paper, and I think that was the thing too. So it's not the paper, it's not the activities that we're doing, it's what we're doing before the activities. So even if somebody put on mask, if you're not washing
Yeah.
your hands before the mask, then it won't matter. So after you've gotten the papers, as long as you're sanitizing your hands afterwards, then you're good to go. Same thing. How remember you mentioned a little while ago about the kids and the outside? The kids are looking down at each
Mhm.
other's cell phones, right? And then they're putting that up to their faces. Same way with cookout. So the outside
Yeah.
air, I'm still sticking with it, will not give you COVID. But if you're at a cookout, okay, and all of the food is laid out, so you got the macaroni and cheese, the potatoes, nothing's covered, everybody hovering over the food. Let's even
Ribs.
yeah, let's the ribs. Let's talk about what ain't nobody even let's say it's all covered, right? But everybody's coming down the assembly line and everybody's touching the same forks and the same spoons. And then you sit down and eat and you don't clean your hands.
Oh,
It's not the outside air that gave you COVID. It's your activities of what you're doing. If you're sitting out and you're playing Bill Wits in the sun, and everybody talking and screaming over the table, y'all can't wash the cards, but at least y'all can implement some routine hand hygiene habits, right? While you're playing cards. But if you're not doing that and everybody's coughing and y'all like, oh, I got a 5 special, and you hollering and you hee-hawing and all of that, those droplets are then falling on the table. Who's wiping off that table?
oh.
So it has nothing to do with the outside air. It has a lot to do with our activities when we are interacting with each other. So these things can be abided by. We just have to do a safer job of what it is that we're doing. I got protocols when people come to my house. I do. I'm talking about, I kid you not. Like, I actually have protocols. If we're going to unmask, there are just certain things that we have to do. Like, there is hand hygiene where you're coming in. If we're going to take off masks, we have protocols, in terms of, we don't swab noses, but we treat noses. So there's certain things that we do, to make sure that we're staying safe in terms of, not being able to transmit germs to each other. So I'm just gonna say, like, think about what those protocols need to be. Come up with those agreements. When I hug my loved ones, we don't talk. That is the agreement. I want to give you a hug and I want to love on you, but we're going to go to a space and we're going to hug and we're not going to talk, so that way we don't have to worry about droplets being suspended in the air. Windows are always open. Our heat bill is high was during the winter time. I keep all the windows open if we interacting with family, so we can have that air coming in and out in that air exchange. So there are things that we can do to stay safe. We cannot live up under a
All
rock.
right, I'm going. Assalamu
Oh, you said assalamu alaikum. Oh my God.
Bless his heart. What were you saying, Dr. Knighton? We love you.
No, I was just saying that, like with the outside air, so we can't live up under a rock. We have to figure out a way. What practices can we do that's going to reduce the risk, and that is going to be the most important thing.
You know, I think everyone here would agree that we need
Thank you.
to have a one-on-one with Dr. Knighton and let her go through, I
Yes.
think, protocols for
Yes.
home, protocols for your office, protocols for when you are in a public space and you need to use the restroom. I
Yeah.
mean, things like, I mean, just on the plane, if you've been in a car traveling. I would like to, I'd be interested, how many of you would be interested in hearing her go through that? I think that would be a wonderful thing. I think it's very important. So we're going to do that. I mean, and this is when we see just how important it is, the work that you do, Dr. Knighton, but just how important it is, the work that you do, Dr. Reeves, Reverend Simmons, Attorney Hoffler, Pastor Williams. I mean, all of this, and Dwight, thank you. It's just very, very important, all the work that everyone is doing. And I just want to thank all of my people who came on out tonight. We just got an inspiration to do this tonight. We haven't done this in a long time. And
Santita,
Lorraine said, yes.
can you bring Attorney Hoffler back? And I noticed she talked about the standpoint of protecting employers,
Okay.
but I
Oh,
am
no, no,
like
no, no, no. I'm a plaintiff's lawyer. I protect the employees.
got employees. So let me tell you.
Employees.
So I personally,
Licensed employers, but I represent employees mostly.
so
Yeah.
I need you, and I feel like I was intentionally brought to you at this moment because when I tell you, I constantly am getting complaints from people that have been fired from their jobs. And I'm talking about even people that's in healthcare that would have been to the front of the line to get the vaccine, right? They got, let's say, COVID because of an unsafe work environment and was fired because they got COVID and then was told that they had to get the vaccine. So I've been seeing a lot of situations that happen like this, and I've had this happen to even close family members that are on the front line. Some of them couldn't get vaccinated early on because J&J wasn't available. So in order for them to be able to get those 2 doses, their employer wanted them to take time off of work, their own paid time off, and if they didn't have that paid time off, they got fired.
Oh my God.
I've seen situations where people needed to recover and they've been fired. So unfortunately, I've come across this, and this is something that people reach out to me about, and I can't help them. And unfortunately, I have not even known how to help them because the resources here has been so biased or
Right.
polarized of me even talking to, let's say, an attorney that's like, well, everybody should be vaccinated. So it completely takes out the employee rights. And so I would be curious. I would love your expertise, like in that area.
Well, that would be a whole show.
I know. That's what I'm
Well,
telling Santita. That's what I'm telling Santita. She needs a whole show for
I
that.
mean, I
well, you
would,
know what? What I will do is to get recommendations from all of you. And what we will do is roll out these shows
Yes.
because I think that people have a lot of questions. And look, I'm a steward, okay? And what I try to do is create and provide a platform, a comfortable space where we can ask them uncomfortable questions and have some uncomfortable conversations. The challenge that we have at this time, and I will continue to say this, is that people are being excluded from the conversation. We
yes.
are demonizing the unvaccinated. We are demonizing the people who ask questions. We're treating everyone as a dissenter if we do not follow a particular line, and that's very dangerous. If people have gotten sick from these shots, and some people do, all medicines carry that risk. We can't ask these questions. And we're not being told what we can do to increase our healthfulness. We have been told that if we just get this shot, we'll be okay. That's not true. It's never true. Life is never just, unless it's following God, it's not just one thing that you do. Okay. So what we will do, I'll work with you, Dr. Knight, and I'll work with you, Attorney Hoffler.
Yes.
I'll work with you, Pastor Williams and Reverend Simmons, on the mental and spiritual aspects because people are really struggling. They really, really are. And as we bring our children back to school, not only do we have our students, but we have teachers. We also have the people who clean up after everybody.
Absolutely.
Is anyone speaking to the janitors?
No one is speaking to the janitors. No one's speaking to the people in the kitchen. No one is speaking to anyone
Yep.
who's an essential worker who's not getting paid money. And
Yeah.
every single day, when we first heard about COVID, those people who are putting their lives on the line, the bus drivers, the people who, I mean, no one. And so I could Santita, maybe it could be entitled "Know Your Rights."
Oh,
Know your
Absolutely.
rights.
listen, when I tell
Absolutely.
you I'm all for it, and when you do, listen, I'm blasting that one out to everybody I know because when I
We'll do it
tell
next
you,
week.
yes, that is so important, and
We'll
I
do it
think
next
beyond
week.
measure. Oh my gosh,
We're
yeah.
going to do it next week because now you're going to have vaccine passports rolling out.
Yeah, well,
Um,
vaccine passport.
you're going to have a lot of things rolling out, and I'm not willing to give up my rights.
Right.
And I don't think anyone should be able to be when you. It's hard to get something back that you give away.
Yep.
But we have to start thinking now. Wait a minute, and you have to look at the fact that COVID is the third biggest killer of people in America. We got cancer ahead of us. We've got diabetes around us. We've got heart attacks and strokes. We have, I have people running after me to give me a shot, but no one's running after me to give me access to health care. Now that's something we got to push for. We need to push for it right now.
Mhm.
Right now. People need help, and people need not only testing, they need to be able to, the way I don't have to pay for this shot, I shouldn't have to pay for therapeutics. How about that?
Mhm.
And
People don't
not
know
just
what
therapeutics
therapeutics are.
after I've been infected, prophylactically.
Yep.
So we need to just let Dr. Knighton, Attorney Hoffler, Reverend Simmons, Reverend Williams, Dr. Reeves, send me your ideas on what you want to talk about. Let's just roll it out. We can roll it out on my morning show. We can roll it out, on this show once a week. We can do that.
Know your rights.
Know
That,
your rights. Know
know your
your rights. Know your rights because
focus
people
on
do
knowing
need to
your
know their
rights.
rights.
COVID, know your rights. You know, a lot of times we do know your rights with police brutality, but
Yeah.
in this case, it's COVID.
Okay. Well, I think we need to talk about all of that. We need to know our rights. We do.
Mhm.
And so I'm really, really, I want to thank Jillian. Wait, what did you say? Jillian said, I could not agree with you more. Take this pill, get this shot. What about a hug? That's what I need. I heard that, girl. And you're getting a hug from all of us, Jillian. And who's this precious baby in front of us with these hats on? Girl, I love what y'all are doing right there. I love it, love it. And I just want to thank all of you for your support. Linear Bob is joining us from California. We love you, Linear. Linear Bob from San Jose, and Kaiser and Daryl and Paula. She was one of my first morning stars. She's been with me since the first day I was on the air. Love you, girl. Daphne, Carol from the left coast. Everybody, I just love you all so much. And I want to thank you in a very special way because Lucretia, for all of you, for what could have been, I think, a very solitary period. I'm an introvert, so I can spend some time alone. I don't mind. I want to thank you for taking me into your life and into your hearts and allowing all of us to become a community. I'm so grateful that I've been able to meet you virtually, Dr. Knighton, and you, CK, I've known for decades. Dr. Reeves, Pastor Williams, Candace, I've known her. We worked on the Hill more than 30 years ago when we were kids, girl. Yes. Oh my gosh.
Were y'all
But I
born
want
30 years ago? Were you born? I wasn't. I mean, were you born 30 years ago?
no, that's right. You were a zygote. I got it.
Right,
Collective fell.
right. I mean, I've been a lawyer for 34 years, but I wasn't really born.
No, girl, it was a thought.
It was right. I just wanted to clarify all that.
Oh, that's right. Come on, Aretha, 29 and holding until she was 78. I'm not gonna say, but I'm not mad at her. She had the spirit of a child. I'm not mad. But I want to thank all of you for opening, not just opening yourself to me, but opening yourselves to each other because you've become a community. You all talk all weekend, and I think it's a wonderful thing. And we are going to return to Dr. Knighton and to Attorney Hoffler and to this wonderful panel here. Pastor Williams, Reverend Simmons, Dr. Reeves, and we're going to march through your rights. We're going to march through how we can be safe in our homes and in the workplace and in church and at these picnics.
Mm-hmm.
And we're moving into that because we've got picnics coming in about 2 weeks with Memorial Day, right? So I think, you know what I'm saying? I mean, we need to know what the behavior ought to be. I mean, how should we, I mean, do you have an assembly line for the food, or do you
Mine
get
just
one
got
person to
canceled.
serve the food?
Watch it on TV.
It's a lot to think about. It's
Right.
a lot to think about because we're not thinking about that. We're not. We're not. But everybody, like and share, and pass this around. I hope that this benefited somebody today. I really do. Pray that you all will have a wonderful weekend. I'll see you tomorrow at the Saturday morning forum of Operation Push. That's on the Impact Network and on rainbowpush.org and on the Rainbow Push page and on the Reverend Jesse Jackson Senior page. On Sunday on Keep Up Alive with Reverend Jesse Jackson, we will be talking from 7 to 9 Central Standard Time about the crisis in India and what that is showing us about how the so-called first world is treating the developing world. Dr. Knight, I hope that you can join us on Sunday on Reverend Jackson's show, because what we're doing is we're not sharing the recipe. It's an airborne illness, right? It's an airborne disease. And so at some point, though, it's going to travel all the way around the world, as my father put it today. He said, as the world turns, COVID will be with us. And we're not sharing what could save some people's lives. What could do that? So we're going to be talking about that on Sunday. And then we'll be back, Lord willing, with you on the Santita Jackson Show on Monday morning. So I'd like to say give a special tip my hat to a man who I've known, those of us who grew up in the Chicago area. We all knew and loved Dick Kay. Dick Kay, one of the great political reporters in the local beat of all time. He made his transition. He was 84 years of age, and he was hosting at WCPT, my home station in Chicago, for several years. And everybody loves Dick Kay, but we love him because he was a dying breed, and let's hope that they will be revived. A real journalist. He didn't play gotcha journalism. He just tried to give you the truth, and he really tried to amplify the stories of those who've been locked out and those who are supposedly little, at least little in man's eyes, but no one's little in God's eyes. So to Dick Kay and his family, may you rest in power and peace, our dear friend. I love you, everybody. God bless you. Thank you, Pastor Williams, Attorney Hoffler, Dr. Reeves, Reverend Simmons, Dr. Knighton. I love you all. And of course, Dwight left us, but that's okay. Dr. Knight, we're going to work on all those. We're going to start working on those things so we can do that rollout next week. Let's just start.
Are we going to stay
let's
on,
start.
Santita, to take care of the stuff we have to take care of?
We're going to let everybody go.
Okay.
And then we're going to do that. But I think we should end the broadcast, yes?
We're going to. Yeah.
Okay. So
Whenever you're
I
ready.
love you, everybody. We'll
Yeah.
let you go. Love you.
Bye.
Bye-bye.